Thank you very much, Senator Carrion, for your line of question. At this time, we'll go to Senator Francis Heyliger. You recognize for your 5 minutes.
Thank you. Good afternoon, well, good morning. Good day, good day. Welcome to my colleagues, testifiers, people of the territory. I'm gonna ask just some basic common sense questions quickly. Has anyone done any research in regards to, as it relates to, for example, and WAPA and their potable water, do people even drink it? And if they drink it, what preparations do they make at home? For example, boiling this water, would that remove the fluoride and make this entire conversation moot when it comes to that aspect? Anyone?
This is Tuka Zokai from the American Dental Association. In terms of boiling the water does not remove the fluoride concentration. It could actually very slightly increase the concentration in terms of the parts per million. But the way to remove the water would involve a reverse osmosis, which could happen if there's a reverse osmosis filter being used, but a typical like Brita filter does not involve reverse osmosis. So it filters the water while retaining the fluoride. So that's the scientific background, but I'm not sure if someone else can speak on the number of folks that do drink the water. That's also why we are encouraging other fluoride interventions until the infrastructure for properly treated water is also implemented.
Well, one of the things that I must note on a national basis where they speak about putting fluoride into the water, a lot of these different states and counties have like one major water source. Here in the Virgin Islands, we're not set up that way. We could touch on individuals that utilize WAPA, and then you have a large part of the population that also utilizes their own personal cisterns. And for me, listening to this conversation, it boils back to quite a bit of infrastructure and public education, and wondering in regards to how a lot of this will even potentially be implemented. I understand when certain things are done on a national scale, but being here in the Caribbean and the way we're set up, some of these things might be a little bit more difficult to implement as opposed to other places. How do you intend on tackling this? Could you share that with me?
Again, others can speak to that more. It's also part of why when we originally came together, we were just talking about water fluoridation. But as we looked at these important issues that you're also highlighting, we said that there are opportunities for more school-based health programs that involve fluoride mouth rinses and encouraging more pediatricians and offering that education to offer fluoride varnish. But if there's a population that is being served the potable water, that would have the optimal amount of fluoride as well, but it's not the only intervention. So for those that are utilizing cisterns, for example, that there are other sources of fluoride if it's not from that specific water system.
2 minutes.
So it's a multifaceted approach.
Please put on your camera.
Oh, yes, of course.
You testified from currently what's the testimony from WAPA is because of the reverse osmosis, there's no real detection of fluoride in the water. We don't have a plan for implementation via cisterns as yet because we now have to look at that infrastructure. So we're attempting to amend something that really currently doesn't even exist. And I am fully in support of bringing things in line nationally, but I also would like to make sure that we're doing bills that deal with the very infrastructure in the first place to even get it implemented before we're amending levels for something that really doesn't exist here in the territory. So that's where my concern is. I am fully in support of the public education aspect of it. I think that aspect that was discussed as it relates to giving children more information, getting individuals into the schools to help deal with dental hygiene and teaching and education, I love that part. But I also have to be practical as it deals to the other part, and also look at the dollars and cents of what would it take to implement this in a community that is structured the way it is. We don't have a single source option. We have multiple sources. We really don't drink the potable water like that. A lot of people purchase bottled water to drink. They just don't use the potable water for consumption. So it's a lot of things that have me questioning how would this be implemented, and the cost. And that is very important, because as a legislator, we're responsible for the purse strings. So how much is it going to cost public education and really getting our children involved in making sure they understand the hygiene part and understand the plus of having fluoride in their system to assist with their teeth, etc., as opposed to us figuring out how to implement this through the water. Based on our community, which one would be best suited for us? Mr. Chair, could I finish?
You may wrap up, Senator.
Thank you. And another aspect of it, when it comes to education, I think we also have to focus specifically, even as a government. One of the things that I think we have to do better at is in negotiating the dental aspect of our contract with Cigna. I mean, it is very limited, where someone might have to have a procedure that is $5,000, and we're limited to what, 12 or something like that, 1,200. So I think there's many aspects, not only from a childhood standpoint, but I'm more leaning towards the educational part and making sure our children are healthy from that aspect and moving from there. So thank you, Mr. Chair, for sharing your thoughts.
Thank you.
For giving me this opportunity.
Thank you, Senator Francis Heyliger.